Hi, I'm Dr. Matthew Barker with Integrative Pain and Wellness Center, and today I want to talk about a specific problem correlated to negative emotions being stored in the body. This problem is called autonomic nervous system dysfunction. The autonomic nervous system is the part of our nervous system that automatically does things without us consciously telling it to, such as blood flow, nerve flow, making proteins, making hormones, our lymphatic system, all these things that are just happening automatically. And when we have dysfunction in the autonomic nervous system, it can impair all of those capabilities. So when we have dysfunction in this system, in a joint or in a muscle or in an organ or in a nerve bundle, it can cause local pain there, it can cause referred pain, it can impair the function of that organ or nerve bundle, and it can also impair the body's innate ability to heal. So if we've had a physical injury in that part of the body, then we may not be able to overcome that injury and get back to our previous healthy baseline. So I see this problem all the time. Almost every single patient that walks in the door has one or more areas of autonomic nervous system dysfunction from some event that occurred in their life. And I was originally taught about this problem during my residency, and the way that you find an area of autonomic nervous system dysfunction is through a simple muscle test. And so if you, for example, had autonomic nervous system dysfunction of the shoulder, touching the right shoulder is going to cause all of that person's muscle strength to diminish slightly for a temporary amount of time. And so that's how you would find an area of autonomic nervous system dysfunction. Same thing with the nerve bundle. We have several nerve bundles in our anterior abdominal area down to the pelvic region. And if you push on those spots and there's autonomic dysfunction, same thing, muscle strength is going to go weak. So this was first developed by a German doctor like in the 1900s. And he then developed an injection to fix this problem called neural therapy. And neural therapy is pretty simple injections, just injecting lidocaine superficially into the body. So going back to the right shoulder joint, if there was dysfunction, autonomic dysfunction of the right shoulder, you would just inject little blibs of lidocaine just barely under the skin, not even in deep into the joint, and just all the way around the shoulder joint. Pretty much anywhere that you touch that causes the patient to go weak, you would inject a little bit of lidocaine. And immediately after the injections, the muscle test would return to normal. So touching their shoulder would no longer elicit their arm strength to go weak. And this change, it may take a couple rounds of those neural therapy injections for that change to become permanent. And so, if a patient had the injections, they would come back in a week or two, and we would retest their muscle strength, and if they tested weak again, we would repeat the injection. So I did these injections for years, and in fact, I have videos of me doing the injections, of explaining how the injections work, and they do work, and I had great results with the injections. The doctor who developed these injections thought it was the trauma, the event, that was causing the autonomic nervous system dysfunction. And after I learned how to find and release negative emotions, I discovered if I just released the emotions from the event that caused the problem, it fixed the problem. No injection needed. And the change was permanent. There was no need to repeat releasing the emotions or anything. And something interesting that would sometimes occur with the injections is patients would have the injections and sometimes come back after and report having had an emotional release. And it was their body releasing the emotions that were connected to the event that presumably caused the autonomic nervous system dysfunction. But when I realized that fixing the problem could just be done by releasing the emotions, I learned what actually causes the problem is not the trauma, but it is the emotions that are created from the trauma, and specifically how those emotions get stored in the body. So normally we generate 5 negative emotions every time that we perceive a trauma or an injustice has occurred. And most of the time, the 5 emotions from a single event are dispersed to different parts of the body. And when those 5 emotions get dispersed, they do cause problems and contribute to physical and mental health issues. However, they don't cause this particular problem with the autonomic nervous system. And so just like if you were to plug too many plugs into the same outlet, I don't know if you've seen the Christmas Story, but all those plugs into the one outlet and it blows a fuse. And so that phenomenon occurs when all 5 emotions from one event end up in the same body part. It's like too much energetic disturbance, and it results in autonomic nervous system dysfunction. So when all 5 emotions from one event end up in the shoulder joint or in the nerve bundle in one of our organs, then we tend to have more issues. This becomes like a chronic weak point in our body, and if we don't address it, it can lead to disease, can lead to osteoarthritis, it can lead to injuries and chronic pain. And so it's pretty funny, I do give my patients the option. I tell them when I explain this to them, I say, okay, we can do the injections. They're safe, they're effective. They do often need to be repeated a few times for the change to become permanent. And I do charge extra money for them. Or I can find and release the emotions connected to that event that is causing this problem, and that will fix the problem the first time, every time, and I don't charge any extra money. Which would you prefer? And so far, I haven't had anybody take me up on the injections, so I don't really do the neural therapy injections because I found a better solution to fix the problem. And this discovery of the true problem being related to the emotions and how the emotions are stored in the body led me to ask a new question. So if releasing the emotions fixes the problem, how do these injections fix the problem? And so I didn't know the answer, so I had to kind of ponder and meditate on it. And I did some research on, what they thought the mechanism of action was of these injections. And that still didn't bring me closer to an answer. And so one day as I was explaining this to a patient, the answer came to me as a flash of insight. I just had this whole knowing come over me, and I knew what the mechanism was. When we suppress an emotion, we subconsciously, our muscles and our organs tighten up where that emotion would have been experienced. And so by tightening up, we're limiting that emotion from being experienced or keeping it out of our conscious awareness. And so what those lidocaine injections are doing, we're injecting a numbing agent in the part of the body where those emotions are being stored. So we're temporarily turning off the body's ability to keep those emotions out of your conscious awareness. And so that allows the 5 emotions from that event to come to the surface. And if patients are not trying to tune in and release emotions, they're probably often going to suppress, repress, numb, ignore, distract, just like they're used to doing. And when they do that, the emotions stay stuck, and as soon as the lidocaine wears off, the problem returns. And so their muscle testing would return back to abnormal. And so that is why the injections have to keep getting repeated. It is until those emotions, even with the patient not, being tuned in and trying to release them, if you bring those negative emotions to the surface enough times, they'll just spontaneously come out. And so that explains why sometimes patients would report having had an emotional release. It was the emotions releasing. And usually when they had that big, noticeable emotional release, the injection didn't need to be repeated. And so if you are having any kind of chronic pain somewhere, if you've had an injury that your body hasn't healed from, if you have organ dysfunction, if you have heart palpitations, or if you have something that has not responded to the typical treatments that most things respond to, there is a high probability that you have autonomic nervous system dysfunction in that part of the body. So I would encourage you and invite you to come in, schedule an appointment. We will evaluate and see if that is part of the problem and address it on your very first visit. And I have a low percentage of patients that need platelet-rich plasma or other regenerative injections, or that end up needing surgery because I'm aware of this phenomenon and how to address it. The autonomic nervous system is so powerful, and our body's ability to heal is so powerful. But these emotions can inhibit and block our body's innate ability to do what it is designed to do. So if you have chronic pain or some other problem, please come in, schedule an appointment, and we would love to help you. Thank you so much.